Welcome to Black Women's Health Podcast. I'm Dr. Rahman, and today's topic is PMDD, which is premenstrual dysphoric disorder. That's a mouthful. But we have a lot to talk about. We want to talk about treatment options, including microdosing with psychedelic drugs. I have the esteemed pleasure of having a guest with me, Miss Tina Williams. Miss Williams is the author of the book, The Woman in the Basement, How to Live Your Best Life 75% of the Time. I think that needs explanation, Miss Williams. And then the subtitle is Menstrual Moods and Mushrooms. I'll tell you a little about Miss Williams. Miss Williams is a graduate of Texas A&M University. She is a veteran of the U.S. Army and has worked for many years as an information systems analyst before devoting herself to PMD awareness and advocacy, including promoting psychedelic research. Again, welcome.
Thank you. Thank you so much for having me.
Okay, so there's some vocabulary that we just need to be clear on. What is your understanding of PMS, premenstrual syndrome, and PMDD?
That's a great question. And I think something that is very confusing kind of culturally in people that don't experience PMDD. For someone that experiences PMDD, I think the distinction is very clear. With PMS being something that most women of reproductive age have experienced in their lives, but it doesn't necessarily impact school or work or daily functioning. They're able to live their lives. Whereas with PMDD, it is a much more severe, debilitating condition that impacts daily life and makes it difficult to keep a job, a relationship, etc.
I totally agree with that. As a gynecologist, what I hear women telling me are things like, I know my period is about to start when they're describing their PMS symptoms. Sometimes they will say, my breasts feel full, or they feel heavy or tender. I have some abdominal cramping. I feel bloated. And these are all relatively minor symptoms, meaning it doesn't incapacitate them. They're still able to go to school. They're still able to go to work, but they know there's a change. And these symptoms usually go away when they start having the menstrual cycle. And also usually there's cravings. A lot of times there's a craving for chocolate. We can think of PMDD as an extreme form of PMS, one that's debilitating, one that is associated with emotional symptoms, anxiety, depression. And so the question sometimes becomes, is it a problem for the gynecologist, or is it a problem for the psychiatrist? Because is this more of a mental disorder, or is it a physiologic disorder?
Yes, that's really a great point. And I think that that's something that, people that have PMDD really struggle with this, because at first they may be referred to a gynecologist, and then they might be referred to the psychiatrist, and then they might be referred back to the gynecologist. So it's one of those of who is or how does that work? And I think PMDD being something that really needs a team of people that would work together to develop a more well-rounded kind of treatment approach.
Can you share what your symptoms were like?
Yeah. So they definitely evolved over time. So I had undiagnosed PMDD for 20 years, which is it's really having it for that long caused a lot of it almost started exacerbating and escalating the longer that I had it, and the longer that it was untreated. So, starting from my first period, right? Like my teenage years were very disrupted. A lot of mood swings, a lot of anger, a lot of rage. I dropped out of high school very young. I struggled to be in an environment with other people during that time. And so, going to school was like torture to me because I just, the anxiety, the depression, and you can imagine that playing out in a high school. And so that was a big part of it. And then I think going forward, like that really just kind of escalated. My time in the military, I got through it. It was very challenging, very difficult, but I got through it kind of during those years. But by the time I was in my early 30s, it had really gotten to the point where like I was having consistent suicidal ideation during that window before my period. And I was starting to plan out how to do it.
Mm.
And that was the point when I started seeking help. I didn't know what was happening. I didn't know PMDD existed at all at that point. But I was like, okay, something's wrong. And I started researching and like.
So can I ask you this?
Mhm.
At this point in your life, did you think I have PMS?
No. I've never thought I mean, PMS, sure. But I guess I never really associated my symptoms to my menstrual cycle
Okay.
until I until I realized that PMDD was a thing.
Okay. Did you have any other gynecologic symptoms associated with periods like severe cramps, what we
Hmm.
call dysmenorrhea?
No.
Okay.
There was not a lot of physical symptoms at all. So
Okay.
even with bloating or breast tenderness, yes, but it wasn't anything that really caught my attention because it didn't cause me any real problems.
Okay. So I'm hearing you say most of your concerns are anxiety, depression. These were
Yeah,
all mental.
yes, absolutely. These were emotions, strong emotions to the point of everything in my life needs to change right now.
Mm-hmm.
It's my job. I have to switch jobs.
Mm-hmm.
It's my relationship. I have to get out of my relationship. It was that emotional turmoil that I was feeling that was causing the distress. But it's so weird with PMDD because the luteal phase is 2 weeks, roughly 2 weeks
Yes.
before menstruation. So it's really difficult to pick up on that pattern.
Before we go too deep, I think I should pause and try to
Mhm.
explain some background physiology so that
Yeah.
we're all on the same page. At about the age of 12, most girls start menstruating. And what that means is that they will ovulate once a month. And ovulation is the process where one egg is released from the ovary into the fallopian tube. This release of the egg is ovulation. That egg is then in the fallopian tube, and if it is fertilized by sperm, um, that fertilized egg can then travel into the uterus, implant, grow. 40 weeks later, we can have a live birth. If that egg is not fertilized after ovulation, it essentially dies, it gets reabsorbed, and the lining, which had been building within the uterus, gets shed. And that's the menstrual cycle. So in a female that has a 28-day cycle, mid-cycle, around day 14 is when she ovulates. 2 weeks later, if that egg has not been fertilized, she'll have a menstrual cycle. That period after ovulation and before menstruation is called the luteal phase. It occurs after ovulation. And so the symptoms of PMS and PMDD, which we are saying is essentially a severe extreme form of PMS, occurs in the luteal phase or in the second half of a menstrual cycle. And so what's interesting is that all of those terrible symptoms pretty much go away. They absolutely go away with the onset of the menstrual cycle. They don't happen in the first half of the cycle, but they tend to recur once she's ovulated and is now in the luteal phase of her cycle. Okay, so how did you make this connection?
Yeah, so it was interesting because, I've never been one to track my periods before, because other than, outside of PMDD, which I didn't know about, but I had no problems with my periods, right? So I didn't have heavy periods. I didn't have a lot of cramping. So it just was a thing that happened, and that was okay. Right. But I didn't pay a lot of attention to it. And so when I was like really being serious about my mental health problems, I started doing a lot of research, and I was like, okay, this is what I'm experiencing. So what does this look like? Right. So I went out and I was like, major depression? No, because it's not consistent. Right. PTSD, I was screened for when I got out of the military, and I didn't meet the diagnostic criteria for PTSD. So I was like, that's not it. And I just kept going, and I was interviewing my friends, because I felt like that helps to get objective feedback from people around me. And one of my friends said something that really put me on a different path. She was like, it's like you're a completely different person sometimes. It's like everything is smooth sailing, everything is great, and then you just blow everything up.
So let me just pause. So not only do you feel terrible, others around you notice a difference.
Absolutely. Absolutely. And so working with my friend in that regard was very helpful, because that's when I started looking at, I was like, okay, my symptoms are cyclical. And then what does that look like? And then that's how I came across PMDD. I wasn't convinced at first. I wanted to make sure. So I started tracking my symptoms. And I did it, I was able to do it in reverse for like the previous 2 months, because I was like, I knew when I had a big fight with my partner that was not necessary. Like I knew when that happened. So I was able to look at the calendar and say, oh, this is a pattern that is correlated to my menstrual cycle. And so that's how that really came out too.
Sounds like it was a self-diagnosis.
Yes.
Is this because you felt as though the medical profession wasn't addressing your issue, or you didn't have confidence in them?
Yeah, so I think that it probably speaks to my nature. I have worked as an analyst for a long time. I am very interested in researching and understanding things. And so I felt that this was all happening prior to seeking help. The reason is because I wanted to understand what was going on with me, or I wanted to get a good understanding of what it even was.
Mm-hmm.
Um, because then, you know, considering like PMDD, I was like, oh, okay, I need to make an appointment with the gynecologist, right?
Mm-hmm.
So that's how it kind of played out. It was me trying to understand first and then seeking help.
Okay, so you go to the gynecologist with the presumed diagnosis of
Mhm.
PMDD.
Mhm.
And was it confirmed?
Yes. So I brought the calendar to the doctor. We talked. I, went over my symptoms. And so he confirmed the diagnosis, um, which is, you know, this is an interesting piece in medical care with mental health. The only way to diagnose anything is through subjective reports, right? It's through self-reporting. So it's, going to the gynecologist to get a test for PMDD, like that doesn't exist, right? So it's a tricky thing with that alone, because it can only be diagnosed through that method.
So you're saying, depending on how you relate your symptoms, you could affect your diagnosis.
Yes, that is absolutely, I mean, and that is the case in all mental health conditions.
Yeah, and I would agree with that. I would just say it is then the job of the doctor to then ask the probing questions
Yes,
to help differentiate, to rule out other possibilities. But back to
absolutely.
this encounter, what was offered to you? Now you have the diagnosis of PMDD. What was
Mhm.
offered as treatment by the gynecologist?
Yes. So they wanted to start out with birth control, um, which is a commonly prescribed treatment option for this, and then followed up with offering a prescription for antidepressants.
At the same time?
If I remember correctly, and I could be off, but I
Mm-hmm.
believe that he he wanted to start with birth control first,
Mm-hmm.
give that a couple of months to see if it helped, and then if that wasn't working, then moving to antidepressants, I believe.
And that's very typical. And I
Mhm.
just want to back up and explain the rationale behind the use of birth control pills in this scenario.
Mhm.
If, as we've described before, this happens after ovulation, anything that you can do that prevents ovulation should prevent the symptoms. And we know that birth control pills work by preventing ovulation. So if you give her the birth control pills, she doesn't ovulate, she shouldn't have these symptoms associated with that second half of the cycle.
Mhm.
And that's usually you're right, that's usually the first go-to medication. And I find that women usually have a lot of mixed feelings about birth control pills,
Mhm.
um,
Mhm.
saying that it's not natural. And it's
Mhm.
true. It isn't natural. It's hormonal manipulation. And the
Mhm.
reason for it is what we've just described.
Mhm.
And if that doesn't work, sometimes it's the antidepressants, usually SSRIs, uh, and either you're taking it every day or you're taking it during those 2 weeks of your luteal phase to prevent your symptoms.
Mhm.
Didn't work?
So I will say that there was some symptom alleviation, in particular in the beginning. But what I noticed was that the efficacy decreased over time. And it also didn't prevent, it wasn't doing enough, right? So there was some improvement, but it wasn't a long-term fix. Um, so
And at this point, are you taking birth control pills and antidepressants?
no, so this is on just I think it was Yaz birth control, I believe is the one they typically
Mhm.
prescribe for that. So I did try that for a period of time, but not, and I do share those feelings about birth control not being, a natural thing. And so I think from a personal perspective, that also kind of played into that of me not wanting to use birth control long term, you know? So,
I won't get into the birth control debate. It is a personal choice,
yeah,
and it's not natural. It's not holistic, and you really have to weigh the pros versus the
mhm,
cons of the medication, and that depends on your own personal situation,
right,
age, health condition, all those other things play
right,
a factor.
absolutely.
So you said no to birth control pills. What about the antidepressants?
So antidepressants, I took an antidepressant when I was younger, actually to quit smoking. So it was completely unrelated. Or I think Wellbutrin.
Wellbutrin, right. Now, that's
Yes.
not an SSRI, but it is
Okay.
an antidepressant.
Okay. So I had some experience with that in my teen, like not teen, but 20s maybe. And my reaction to it was not good.
Mm,
I had a really rough reaction to it. And so I had to stop it almost immediately. And so with that experience, and I know, that all antidepressants, like they're different, but with that experience, I felt very uncomfortable at that stage in my life
yeah.
because my symptoms they were so severe. By that point, I was like, I'm really actually contemplating suicide.
Mm,
And I felt at that point that SSRIs were a very risky option for me
okay.
in that state.
Okay.
And so I did not pursue, so I've never pursued SSRIs for PMDD. Um,
Were you seeing a psychiatrist or a therapist at this point?
no,
Okay.
only my gynecologist.
Got you.
Um,
Okay. So, what happens next?
yeah, so I think that I very much felt like I was at a breaking point, um, of like, I can't live like this anymore. And so I started doing research and I was, just looking like, what are the alternatives to SSRIs? Like, what other options do I have? And I came across psychedelic research in particular, major depression, and then also PTSD. And so I was looking at that and I was like, the symptoms of these other mental health conditions it's like, I always think PMDD is like if major depression and PTSD had a baby and it only happened during the luteal phase. Um, it's,
Okay.
it's like that. And so I
So
was,
I'm sorry, that's an interesting description. Are you trying to describe the intensity of the feelings?
yes, I think the intensity of the feelings and then also the symptoms. Like the symptoms of major depression and PTSD are both within the PMDD diagnosis, right? So the suicidal ideation, right, being an important one. that like overly depressed mood, like you have a cloud on you,
Mhm.
like that's that major depression feeling, which, speaking like, I don't have experience with these other mental health conditions, but that is my understanding from the reading. Um, so yeah, I just was looking at it and I was like, this is very interesting. So I started going down that rabbit hole to understand why psychedelics would be useful in these other conditions. And that's really where it all started. For me, looking into microdosing for PMDD.
Well, how did you go about doing that? And how did you figure out what's a microdose?
Yeah, so I was not good at it at first. Um, so it was, I do have a good friend in my life who has had experience with it in the past with bigger doses and various different ones. So that was very helpful because I had someone to like confide in, and that had firsthand experience, that was able to explain it to me, explain what the experiences were like, explain, possibly how it may be helpful for these different conditions. Um, and so, yeah, and as far as like how to do it, I think I was very, I did a lot of reading. There's a lot of information out there online for different protocols and different things like that. So it was very much like a self-experiment, essentially.
And I do want to emphasize that what we're sharing today is just informational.
Yeah.
Neither myself or the guest is recommending that anyone do this without serious consideration and consultation
Yeah.
with their health provider.
Yes.
There can
Yes.
be negative consequences if you are not aware and prepared.
Yes, absolutely. That's a great way to put it.
So, interesting. Do you remember your first experience with microdosing and the effect in terms of now we know that this can happen over days when we're talking about the PMDD. So,
Mhm.
when you did it, how soon did you see a response? Did it last the entire time? Did you have to change the dosage? How were things for you?
Yeah, so it was a bit of a chaotic process, but I don't say chaotic in a negative way. More of, you know, starting out taking very small doses, there wasn't a noticeable effect in like, you're not having visions, and you're not seeing different colors and geometry or anything like that, but
No hallucinations.
no hallucination. So we're
Does it
talking,
feel like you've had two glasses of wine?
yeah, it's similar to that, but I would say that it's more similar to cannabis.
Mm,
A little bit more similar to cannabis, with a distinction that cannabis can sometimes feel a little cloudy mentally, like a little cloudy, whereas psychedelics tend to increase focus. So it's the opposite in that regard, but the kind of feeling of cannabis is similar there. Now, I want to add that in this context, we're really talking about microdosing, where the effects are very subtle. So in people that use that microdose, they will go to work. They like, you carry on with your normal everyday activities
that was
because it
my
is
next question.
sub-perceptual.
you're able to function, you're able to
Yes,
go to
yes,
work,
right,
you're
right.
able to drive a car.
Yes, absolutely. This is a very sub-perceptual dose. If Now, this is kind of the thing with microdosing. Once the protocol is dialed in, and I think that's a key point, because while first experimenting, it's difficult to understand, okay, what is the dose that is going to work for me,
Mhm.
while maintaining that sub-perceptual effect, if that makes sense. So
I guess we should say that when we're talking about the standard dose is the dose that's hallucinogenic.
yes, yes,
And so when we're saying microdose, it's my
right,
understanding that we're talking about somewhere like 1/10 of
exactly.
a standard dose.
Right, right. Um, and so the other thing in that regard is that, for women with PMDD, it tends to be even smaller of a dose than that. So even smaller, because let me see how to explain this, but it feels as if there's a little bit of sensitivity in women with PMDD, typically speaking. So like um, maybe where um, a little increased sensitivity to things like wine or to cannabis, right? So in those regards, like even smaller of a dose than what would typically be considered a microdose, if that makes sense.
Yeah, so this is a question that I don't know if you can answer or if you
Mhm.
had. So the dose, it's a microdose. The physical effects are minimal.
Right.
There's no hallucinations. Then how
Mhm.
can it have such a dramatic effect on the PMDD?
Yes. So I would say that it's not like the visual experiences are one thing, and that's typically what people think about when psychedelics come up. It's like, oh, it's visual, right? But psychedelics also, it has a lot to do with emotion. And so for me, I felt like I was better able to process emotions that were coming up during that time, where I was able to be almost like, if you think about being in a meditative state,
Mhm.
like, you're just very kind of zen and very grounded. And so it's a feeling like that. Um, that is the part that really was helpful to me, because it's like those emotions were still coming up, right? Those emotions were
Mm.
still there, but I was better able to process them.
So that's interesting. I'm hearing you say that you might still get angry with your boyfriend,
Right.
but with the microdosing, you can almost step back
Yes.
and not just go off and lose
Right.
control.
Right. Absolutely. And I think that,
So,
uh,
are you still feeling some depression? Are you still feeling some anger? It's just not affecting you in the same way.
yeah, so depression, depression, not so much. I don't struggle with that. I mean, every once in a while, sure, everyone has,
Sure,
depressed days every once in a
sure.
while, but they're very different than in the past and they don't last long. Um, the anxiety is something that I'm still working through. So
Mm-hmm.
that's my current kind of journey is okay, I know I have a little bit of social anxiety. I'm at a point where it's like, okay, I do want to start making friends. I do want to start dating again, right? So I'm just at that place where it's like,
Mhm.
okay, it's time for me to, go into the world a little bit more and work through
Yes.
that anxious tendency. Um, so yeah, I think it's very much a matter of like that mindfulness, to be able to have those really heavy emotions, but not react to them in a way
Mm.
that
Yes.
disrupts all of
Right.
life.
It sounds as though you're in better control of
Right,
your
right,
emotional state.
right.
And is once enough during a luteal phase, or do you have to repeat this? And how often, if you?
Yeah. So that's a really good question. I think like to me, when I think of PMDD, like in my own experience, right? Like I had this for 20 years without treatment. And so that's something that I keep in mind of, you know, the experience of PMDD can be very traumatic. Just experiencing it every month. And so that's something that I always add into the conversation because in some people, let's say you've only been experiencing PMDD for a year. And let's say that, it's maybe not necessarily, you're not contemplating suicide, right? Like
Mhm.
it's a problem for you, but you're not quite there. It's not as severe.
Mhm.
Um, to me, in those cases, it may take less, right? But for someone like me that has had it for 20 years, like I really started to understand, oh, I need to be very gentle with myself because I'm unraveling and unpacking something that has been occurring for 2 decades. And so yeah, I think that gives it some context of like, yeah, this is still something that I'm working through. I
Mhm.
will say that my psychedelic use currently for me, I don't do it very often at all.
That's
I
because you don't have the PMDD anymore?
Well, it's the symptoms are much less severe, but I think it's also because psychedelics really helped me to become a much better meditator.
Oh,
So I'm really able that very mindfulness, that place of mindfulness and that place of Zen that the mushrooms really introduced me to. I can go there in meditation. And I think that that is common amongst, people that use psychedelics. And so that's really been my personal
that's interesting. So I'm
experience.
hearing you say that you've gotten to a point where you don't need it every month,
Hmm.
and you found yet another alternative meditation, which
Yeah.
is working equally well for you.
Yes.
And is it a goal not to need it, or it's not necessarily a goal?
It's not necessarily a goal. I think I'm interested in more ceremonial settings now where it would be more of a gathering with friends, more of a communion.
Mhm.
So I'm interested in that, but that wouldn't occur, on a regular basis. So
Sure, sure. Do you have, or did you have any experience with ketamine? And I should say that
mm,
in an upcoming podcast, there will be a doctor coming in and talking about the use of ketamine for PMDD. But have you had any experience with ketamine?
yeah, so I have not had experience with ketamine, and I'm also not well read on ketamine, and so I'm interested in what your next guest has to say about that because there is um, a lot of, there's discussion on it. So it's kind of like that's where I'm going next with research, is digging into that and understanding it better.
And do you have any concerns about the sources or how one, the problems associated with trying to procure
Yeah.
psychedelics? And I think Oregon may be the only state where there's a medicinal use for psychedelics. And outside of that, you are essentially outside of the law.
Right, right. So Oregon, and I think they're currently open for business in Oregon, I believe, for like the healing centers there. And then Colorado will be next. They are setting up the framework and legislation now.
Mhm.
So yeah, it is. It's an interesting thing because there's so much research out on mental health and psychedelics, right? So there's a lot of discussion around it.
Yes.
So we have that part, while at the same time, they are controlled substances. So then we know, I mean, that what happens with that, right? So then you have people that are trying to research their conditions. They want to get better. You know, the treatments that they're using might not work. They are, especially in a place where people are contemplating suicide, right? You're going to eat a mushroom before you do that. Um, so that's part of the problem that we have right now, is around like safety. How
That's
does that work, right? And the risks involved, both sides of the risk, for people that are struggling with mental health that aren't finding treatments that work. That's a risk, and are at risk for suicide, right?
yeah.
And then you have the other risk where it's like, okay, this might help me, but it's illegal.
Mhm.
And it's completely different than anything I've ever, it's not, it's very different. So you have kind of this, yeah.
It's a dynamic landscape, and there are a lot of
Yes.
changes. There's a lot of interest. What
Right.
does your advocacy work look like? And do you have any suggestions or recommendations for reliable sources that people could go to for information?
Yeah. Yeah. So just recently we started the Dysphoric Project, which is a nonprofit focused on advocating for psychedelic research and premenstrual conditions. So we do have a collection of case studies. So that's one of the things that I work on, is interviewing women with PMDD that have experience with this, and what were their experiences like. And do they have any, especially if they're having, negative experiences as well. So, what does this look like? And so getting all of that documented. We have some harm reduction guides as well. That's very critical in work such as this. So at this point, like, do have some things that are out there. And the next stage is launching a peer support community,
Hmm.
which we're working on for January.
Mhm.
Um, because then it's like, especially with PMDD, it's like talking to other people that have PMDD about this is probably a helpful source of information, because it's really a very unique condition. So I think having that extra support is important for that.
I think you're right. In terms of prevalence, whereas PMS, the discomfort that
Yeah,
the majority of women feel, PMDD, I think the numbers are 3 to 8% of the
yeah,
female population. So
right.
it's not a large number. And I would imagine for the woman who's experiencing this, it's very isolating.
Yes, yes. You said it exactly right. It's 100% isolating. And yeah, you feel like no one understands the severity of or like the intensity of it. Um, and so it's
I would
even,
imagine it would make you feel like I'm going crazy.
yes, yes, like I'm going crazy and no one, it's like
Do you
I'm on
realize
fire.
do you realize that you are reacting out of proportion to the circumstance, or in that moment, not necessarily?
Mm, I don't think so because it's like the thought, or for me anyway, the
Yes.
thoughts that would come in, the thoughts and the emotions that would come to me during that time were so heavy that it, I didn't feel that I was reacting out of like, my reaction was really you know, it, so it wasn't that it was out of proportion, from like an intensity standpoint, but I do feel like I needed to redirect the processing of it. So like, instead of yelling at my partner, right, I needed to understand why that particular thing was so triggering to me, right? Or why this thought,
Mhm.
why I was having these thoughts. So it was, instead of reacting externally, reacting internally in a way to
Yes.
understand what that was.
How did
Um,
it affect work or home life, children? Could your children tell?
oh yeah. Oh yeah. I think that my relationship to them has changed
Mm.
quite dramatically. And I think in a very like positive way, because that being more mindful and being more you know, grounded, that really is contagious,
Mhm.
right?
Mhm.
So yeah, so it's like when I'm around them and when I'm having conversations with them, it's a much more like things flow much easier. There's not a lot of like conflict, or I'm not yelling at my daughter because she didn't make her bed,
Mhm.
or something simple. Like,
Mhm.
I'm not doing like, things don't bother me the way that they used to,
Mhm.
in that regard. So yeah, it's been very helpful for that.
So I need to thank you for opening up your life and your experiences. And at this point, is there, looking back on all you've been through, because it was years before you had your
Mhm.
diagnosis,
Right.
is there something that you wish had happened sooner, or something that you
Mhm.
had done earlier, or any advice that you could give to a woman who might feel as though she's in a similar situation?
Yeah. So I think that looking back, I should have um, looked at my experience, right? I should have been more mindful of that, of um, like these experiences are really disrupting my life, and seeking help sooner. I think because and like I said, it's like things really escalated for me with untreated PMDD. So I think getting treatment as soon as, even if you think it might be a problem, seeking therapy, especially. I was just telling my daughter the other day, she's in college, I said, we need to get you in therapy, just because everybody needs a therapist. And so I really changed my mindset on that. of like, oh, everyone needs a therapist. It's like a primary care doctor. It
Mm.
doesn't matter if you have mental health conditions or not.
We all
This is
have
the
issues. Yes,
process.
yes, yes.
Yeah.
Thank you again. Tell us about
Yeah.
your book or anything else that you would like us to be aware of in terms of the work that you're doing.
Yeah. So I think the Woman in the Basement, that was my first book. It's very like self-development as it relates to PMDD with a little bit of microdosing. Um, and then the Dysphoric Project is the kind of evolution of that, of like, this is nonprofit work where we're really trying, we're getting organized. We are, partnering, and we are really trying to make a difference when it comes to research, because we need to understand more about safety in the female population. And we don't have that it doesn't exist in psychedelic research yet. So it's very much about moving the ball forward there.
Very good. I said I was going to ask you to explain the title, Woman in the
Oh,
Basement,
yeah.
How to Live Your Best Life 75% of the Time. What does that mean?
Yeah. So I really, it was very much like when I realized I had PMDD, I didn't know that I would ever get better, right? I didn't know what was going to happen there. So, yeah, so 75% of the time, that's 3 weeks of the month. So for me, I had symptoms for 1 week out of the month. Thankfully, I didn't have the full 2 weeks. So I was like, okay, I have 1 week, and we called it Hell Week. I was like, I have Hell Week. It's happening once a month. But the rest of the weeks, like, I'm free and I want to live my life, right? So I wanted to enjoy the rest of the time. And I think that also played into it, also helped me to improve Hell Week,
Mm,
because there's this cool thing: if you're having fun or if you're enjoying life,
mm.
right, then some other things might not feel as heavy,
Mm.
right? So yeah.
All right. So now it's 75% plus.
It's 75% plus. Yes, thankfully.
Fantastic. It was a pleasure. It was a pleasure.
Yes.
I really
Thank
enjoyed
you.
speaking with you.
Thank you so much. I appreciate you having me on.
All right. Take care.
You too.
Bye.
Bye.
And yes, Black women experience PMDD. In fact, some say that it's worse in that many Black women feel as though because there's the stigma of being superwoman that they should endure even more without complaint. If you know of a Black woman that would like to talk about her experience, feel free to have her reach out to me at mail@drrahman.com. Mail, MAIL, at Dr. DoctorRahman.com. Mail@drrahman.com. We all have a story.